Welcome to the FDM Academy, and today we're going to talk about the elephant in the room, pain during the FDM treatment. Stick around and we'll get into that topic next. So, you may have heard that treatment in the FDM is painful. And to some practitioners, this is a totally repulsive idea that we would actually cause discomfort. There are many people that are not comfortable inflicting some pain to their patients. Now, it is extremely important to let you know that yes, the treatments of 3 of the distortions can be uncomfortable. While the treatments are painful, our goal is not to cause pain. Our goal is to only cause enough discomfort for the patient to improve. Just as important as limiting the amount of pain a patient has is conserving our own energy. If you're seeing, let's say, 20 patients in a day, if you're using maximum force for every patient, often unnecessarily, you're going to be exhausted before lunchtime. So learning to mitigate that intensity with which you're treating your patients is super, super important. That gives you the longevity to see patients throughout the day. Now, do not think that you're going to start treating patients in the FDM and that you're going to be able to treat 20 people right away. Your hands and your thumb and your forearms will all be sore. When I started treating in the model, I was working at a walk-in clinic and a patient would come in with a sore throat, chest pain, abdominal pain, elbow pain. And then there would be another sore throat or earache or cough or pneumonia and then an ankle pain. Unless you're going to practice full-time manual medicine, you're not going to be treating every patient right away with the fascial distortion model. You'll get an opportunity to work into conditioning your hands and your body. It's a very physical process, and frankly, I think it's why the fascial distortion model isn't embraced throughout medicine, because many people aren't willing to put in that physical effort that's required to treat a patient with many of the musculoskeletal complaints. It's my hope that you'll embrace a tool that, while sometimes can be physically demanding on yourself, can give your patients tremendous relief. Now, as a practitioner, it's my goal to get better and better at treating those distortions in such a way that the pain the patient is experiencing is minimized while the distortion is corrected. I know there's patients who were treated 14 years ago when I first learned the model, and they experienced more discomfort than was necessary. As a practitioner, my goal is to improve a patient's function, help them heal themselves. And if that discomfort is more than they need, that's unfortunate. So our job as practitioners is to learn to modulate the intensity of our treatments for those painful distortions to just enough to correct the actual distortion. So I encourage you as FDM practitioners to work on learning to palpate. And that palpation is critical. Learning to palpate and feel the distortions and feel the corrections is one of the most powerful things of the model. And that's what I hope to talk about in another video. Thank you for joining me, and until next time, stay in the model.